tophi.
Okay.
So for inspection,
So lump and bump. So you have to do inspection and palpation. So you start with inspection. Inspection got 6S. What are they? So
site,
okay, first sight. So what can you mention about the number first lah, number. Okay, how many? So multiple or solitary. So there are multiple swellings. Site will be, and then you, for convenience sake, you pick the largest swelling for examination purpose. So here we will pick this. So site is
and
dorsal aspect of the right wrist. Okay. Then after site will be size. So you measure, you're inspecting only, right? So you estimate. Okay, you estimate the size. It's almost like 5 cm by 5 cm, and mention that I will later confirm the exact dimensions using measuring tape during palpation. Now you're just inspecting that. Okay, then size, shape. So what's the shape? Circular. Okay, then surface. So is the surface smooth or irregular? So here it is smooth. Okay, smooth. Then skin changes, like any discharge, infective picture, inflammatory pictures. Okay, redness, okay, some sinus, some scar, anything like that. So you don't have to mention one by one, no scar, blah blah blah. So no changes, no skin changes. Then after that, so no scars also.
site related.
Okay, site related. So sometimes, let's say you have swelling at the back, you will want to ask the patient to push against the wall. So here you might want to ask the patient to flex and extend the wrist also. Okay, boleh buat macam ni. Okay, see if the swelling changes the appearance or something. Faham. Dia letak sini. Okay. So anything else in inspection? Then palpation. Now you go to palpation. So what do you palpate?
The size.
Palpate the what?
Measure size.
Okay, you measure. So you use a measuring tape, Taylor's tape. Don't use a tiny one. It must be a large Taylor's tape. So measure. Okay, maybe 5 cm, 5 cm, like something. Okay, then.
Temperature.
Okay, temperatures. How do you do? With dorsum of the hand. Okay, if you use compare. Okay. So here actually there's raised temperature. Temperature is raised here. Okay. Then tenderness. So you palpate, look at the patient's face, no dryness, indicating no tenderness. Then margin. So how do you palpate margin? Okay, so you just palpate using the pulp of the index finger. So it is well circumscribed margin. Then age. What is age? So how do you palpate for age? Remember, ulcer age is different, this is different. So age, you use your, how do you palpate? Use your index finger and just palpate at the margin. So what's the significance of doing this?
To see if there's any diffusion.
Read the exact words.
Edge of swelling is any check for
Okay. Erosion, yes, you look for erosion. So where can erosion, so see if you can actually go deep for erosion signs. So where can you get erosion? Dermoid cysts. And also in lipoma, what will happen when I try to palpate the age? Slip sign. So if it's lipoma, the moment I use my pulp of the index finger and push here, it will move slip sign. Slippage sign, very important in lipoma. Then after that, surface. So use the pulp of the fingers. Okay, so it's smooth. Okay, slowly move. Smooth surface. Then consistency. So this is hard. How to know if consistency? This feels like I'm touching my forehead, so it is hard. If it feels like I'm touching my nasal cartilage, it is firm. If it feels like I'm touching my lips, it is soft. So this is bony. This is firm, hard on palpation. The consistency is hard. Then what is reducibility? There's two, reducibility and compressibility. What's the difference?
Reducibility is when you can reduce the size.
Yeah, so reducibility, something like hernia. Okay, so when I push, when I compress, the entire swelling will disappear. That is reducibility. Compressibility means? Compressibility means when I put pressure on the swelling, it partially decreases in size, and when I release the hand, release the pressure, it returns back to its original size and shape and dimensions, etc. So this is not reducible, not compressible. Then pulsation. So how do you want to track for pulsation? Use the two fingers. Look for any. It's similar like looking for trills. Okay. And alternatively, if this is positive, you can later on take the stats and use the bell to auscultate. Look for bruit. malignancy or hypervascularity. You know what else?
Fluctuation.
So how to do fluctuation? Yes, two ways. You just stabilize the index finger, ring finger, use your middle finger to push here. So see if there's any fluctuance. You can feel with your index and ring finger. So there's no fluctuation. Cystic swelling will be fluctuant. Or you can even do this. Okay. See if there's any fluctuance that you can feel. Then
Fixation to skin.
so how to check for fixation? Very important. How to check for fixation? Skin. Fixation to muscle and skin. So skin means you pinch. So it's not fixed to the skin. I can pinch the skin. It's not fixed to the skin. So whatever the swelling is, it's not attached to the skin. It's coming from a deeper structure. Then attachment to the muscle, how to check? Ask him to contract. So ask him to contract the muscles, then see if it's mobile. Okay, release, relax. Okay, so first check for mobility. So this is actually mobile, vertically mobile, horizontally mobile also. Okay, but when he clenches, okay, mobility is restricted. It is not mobile. Not mobile. So that's how you know that it is actually attached to the muscle. Okay, the moment you're compressing like breast, when you ask them to compress the pectoralis, if it's attached to the muscle, it won't be mobile. Then
Fixity to deeper structure.
you just did that. Then
Transillumination.
transillumination, very important. So it is cystic swelling. How do you transillumination?
Use of this.
Yeah, so you use a microworm and then okay. Okay, the part paper. Okay, so here the paper, make a tunnel out of it. Only in short case, okay, so 6 minutes will be going. Let's see how long I take to roll this. So your external will be staring at you, your internal will be staring at you, and while you roll this, right? So make sure you do it in an efficient manner. Okay, so you put, so now I can just see it's all dark. So I shine from the side, okay, and I shine here. So if it's transilluminable, it will glow from here. So this is not transilluminable. Okay, from here. So see, okay, there's nothing. It looks the same to me. It still looks, everything is dark. If it's transilluminable, there will be light glowing, okay, which I can see, illumination which I can see. Then after that,
Auscultation.
auscultation. So just now we check for trill. Use 2 fingers to check for trill. Then you confirm with the auscultation. Use the bell or the steps, hold here and just feel for any bruise. So that's how you go for any lump and bump. Okay. Then if it's at the, you want to do extra examination. So for example, this swelling is coming at the wrist region, right? Wrist. So wrist region, it can always cause peripheral nerve injury. So it can compress a median nerve, ulnar nerve, and you want to just do screening for radial nerve. So you can do screening for these 3 nerves. It is positive. You do the complete peripheral nerve for that particular nerve. So how to screen for median nerve? Cik boleh buat macam ni. Ask him to do it yesterday. Okay, thank you. Okay, ask him to do yang ni, jari-jari letak. Okay, so okay sign. So if you can do okay sign, means the flexor pollicis longus and the flexor digitorum profundus, which flexes the distal interphalangeal joint, okay, or is functioning. So these are due to intact anterior interosseous nerve, which is supplied by the median nerve. Okay. Then how to rule out ulnar nerve compression? Look at for guttering of the interosseous muscle. Interosseous, all this will be wasted. Ask them to, you boleh buat macam ni, adduct and abduct the finger and test for the power. Okay, boleh do, bila buka, it's strong. Bila buka, it's strong. So the abduction, if ulnar nerve is injured, interosseous muscle, so posterior interosseous will cause adduction of the fingers, dorsal interosseous will cause abduction. So this movement will be weak. Radial nerve, of course you look for, first extend, okay, then jari, okay. So you look for wrist drop or finger drop. So finger drop means you won't be able to extend the finger, and wrist, okay. So just, of course here the swelling is restricted in area of movement, not because of nerve injury. That's what you do. So your wrist, you can typically get ganglionosis compressing median nerve, rheumatoid arthritis compressing, all this you can get. So this is general flow for lump and bump.